Hello, I'm Paul Peterson. Welcome to Aging Well in LA. Today we're going to be discussing cataracts and cataract surgery. Now, don't be squeamish. This is a usual part of the aging process, and there's a lot of remedies. And we're going to talk to Dr. Uday Devgan, who is a premier ophthalmologist. I think you'll find the show fascinating. Please stay tuned. Welcome back to Aging Well in LA. Today, I'm going to introduce you to one of the premier eye doctors on the planet, Dr. Uday Devgan. Thank you so much for making time for us today.
My pleasure.
What a pleasure. You have written a book that can reassure many elderly people who are struggling with dimming vision. It's called Cataract Surgery, A Patient's Guide to Cataract Treatment. Now, you know what's fun? This is a case of local boy made good. You're a local boy. You were right here in Santa Monica, the west side of L.A.
Yeah, I grew up here in Santa Monica, went to Santa Monica High School.
Yes.
I was one of the kids who spent a little bit too much time in the library. So the good news is I was valedictorian. The bad news is it was tough for me to get a prom date. But I did very well in school. Then I went locally. I went to UCLA for college, where I majored in microbiology and molecular genetics. USC for med school, where I was top of my class. And I went back to UCLA for all my eye surgery training at that Joel Stein Eye Institute. And I still do it now. So now, 11 years after all my training, I do private practice for the most part, but I still love teaching. So I spend a day a week teaching all the UCLA docs about how to do cataract surgery.
So, you see, you've got the doc who teaches the doctors. This is really such an important issue for our audience, seniors and their caregivers. Maybe a description of what a cataract is, how it develops, and how we might recognize those symptoms.
Well, the first thing is a cataract is not a bad problem. It's a normal age-related change. Light gray hair, if you live long enough, you're going to get a cataract. You can't avoid it. A little simple model here. You know, in a normal eye, you look at an eye, you'll see the eye has this outer part. There's a colored part, like I have brown eyes, some people have blue or green eyes. Behind that iris, inside the eye, there's a lens, like a camera has lens. There's a human clear lens. So if you look in a young person's eye, a child's eye, the lens is clear as water. And therefore, the pupil, when you look at it, looks nice and black. But with age, what happens is that human lens becomes cloudy. So when you look through the pupil here, there's a little yellowness or cloudiness there.
Yes.
So the cataract surgery is very simple. It just means taking out the cataract, which is the cloudy lens, and we replace it with a brand new, clear, man-made lens. So it sounds like it's a big invasive procedure. Patients sometimes have a little bit of fear about it.
Well, of course.
It is surgery on your eye, but the nice part is, with the more modern techniques, this entire surgery is no needles, no stitches, no bleeding, and 5 minutes. Patients can literally see 10 minutes after the surgery.
That's fantastic. Now, what the surgery consists of what? An incision in the eye?
Yeah, so the older way of doing the surgery was to make a very large incision. So you had to make a large incision. And this is what you may remember if your mom or your grandfather had cataract surgery. They made a large incision, they took out their lens, sewed up the eye, and they had these big, thick glasses. Don't worry, that's a thing of the past. Surgeons who do more modern-day surgery, the eye is numbed with just eye drops. The body is awake, you're relaxed, the eye is numbed. A microscopic incision, less than 1/8 of an inch, is actually made with a gem-quality diamond. There's no steel knives.
Wow.
That little tiny gem-quality diamond makes a tiny incision. The old cataract is broken up into 1,000 pieces and vacuumed right out of the eye. And now to get the new lens in the eye, the new lens can be rolled up like a carpet, put in that tiny incision, and open the eye. Therefore, the entire surgery can be done in just a few minutes with literally zero pain, zero stitches, and patients can recover vision within an hour.
Now, is this lens that's inserted, does it correct vision as well, besides getting rid of the cloudiness?
Exactly. Remember this, cataract surgery, first I always tell patients, this is the most important surgery you'll have in your lifetime. And I say that because you will see the world every waking moment for the rest of your life through this surgery and through that lens.
Wow.
So this is a time where it doesn't matter if you bought the best HD TV, if you had an unfortunate situation with your surgery, you'll never realize the benefit of the TV.
Exactly so.
So the lens that goes in the eye is fortunate. We can not only correct the cataract, but at the very same time, fix your nearsightedness, your farsightedness, your astigmatism, even your need for reading glasses.
Whoa, and you're talking my language now.
So examples, I did my mom's cataract surgery about a year and a half ago. Don't worry, I gave her a discount. But, no, in all seriousness, when I did my mom's surgery, I put in one of these new generation of what we call premium lenses. So the lens my mom has in her eye can give her far vision and computer vision and reading vision all without glasses.
Wow.
So now my mom is certainly of the Medicare age, but she's among the only one of her friends so far who has absolutely no glasses.
Wow, that's fantastic. Now, that procedure was an interocular procedure, is that, or is that what the lens is called?
We call the lens an interocular lens. This intraocular lens is actually in the eye, as opposed to a contact lens which would sit on top of the eye, or glasses lens which is in front of the eye. So intraocular lens means the lens is actually in the eye. You'll never feel the lens. You'll never see the lens. Someone who looks at you can't tell you've had a cataract surgery.
Wow.
So it's back in its normal anatomic position.
That is fantastic. Now, for our audience, what are the signs of impending trouble with your vision? Now, I hear the expression floaters, or it's like little balls going through your vision. It seems like people should be alert to that, shouldn't they?
I think it's important for everyone to get their eyes checked at least once a year.
Once a year, eye check. Okay.
If you're certainly of the Medicare age, you want to make sure you're being seen by an ophthalmologist who's an MD, a medical doctor, who specializes in eyes. Optometrists are great, but these are the doctors who are primarily doing the glasses and the contacts.
Right, of course. But an ophthalmologist is really the person you need to go to if you've seen these floaters or your vision is deteriorating.
Exactly. So fluctuations in vision can happen. Floaters are usually a different thing than cataracts. It's usually opacities in the gel of the eye. But important to be checked out. The normal signs of cataract are very slow and gradual, so patients don't often notice it immediately.
Yes.
It's as if a light is slowly being dimmed on you. Among the first signs patients notice are, it's tough for me to drive at night.
Oh, yes.
I used to like driving at night, now it's kind of tough. I want to be home before it's dark. Another thing is they'll say it's tough for me to read the street signs, even with my glasses, or I can't see the words on CNN anymore.
Now, I know it gets people kind of squeamish and upset when they think about, my goodness, surgery on my eyes, and yet the patient experience can, in fact, be pretty easy, right?
Yeah, it can be very, in fact, even pleasant.
Really?
The surgery is literally only 5 minutes, and it's done when the patient's totally relaxed, awake, but in somewhat of a slight twilight state, so they're very easygoing. The eye is completely numbed. I tell patients it takes about 2 drops of my medicine to numb the eye, so I put 6 or 7. And they laugh, but I say, I give the same surgery that I'd want to receive, and when I go to my dentist, I always tell them, hey, give me a little extra of the numbing medicine.
There you go. We actually have some video that your office provided, which sort of chronicles the patient experience. And I'd like you to look at that video now so you can be reassured this doctor knows what he's talking about.
Donna Gallagher, who just recently retired, is an energetic woman who stays very active. But Donna had a problem. The Los Angeles woman had cataracts developing. Her vision was worsening. Understandably, she wasn't happy.
I first began wearing glasses when I was in college, and as the years progressed, my vision became worse. In probably about 2003, the doctor that I went to said, you've got cataracts forming.
Donna mentioned what was happening to her eyesight to her 83-year-old father, who is still a practicing physician in Southern California. He told her to do what he did and have the crystal lens implanted. So she called Los Angeles eye surgeon Uday Devgan, who had treated her father.
Yeah, Donna's a very typical crystal lens patient. She came in and saw me, and she had mild to moderate cataracts. She could still see. She could eke out the letters to barely pass a driving test. But it wasn't enough functional vision for her to enjoy watching her new HD TV, enjoy reading a book, or drive at night. Everything went just beautifully.
Donna had been wearing glasses and contacts since high school. At first, she couldn't imagine her world without spectacles and contacts. But since her crystal lens surgery, she's been happily learning to live without depending on glasses.
That's a good option.
The crystal lens is a revolutionary technology that flexes like your eye's natural lens. The crystal lens often enables patients to see up close, far away, and everything in between.
I love to cook, and once I retired, I wanted to take cooking lessons, and I wanted to try all kinds of recipes, and I also love to watch old movies. But the problem is the TV is kind of across the kitchen, and I'm up close here working with my recipes, trying to figure out what I'm doing. So I would always have my glasses on a string around my neck so that when I wanted to see what was happening, I'd have to put the glasses on because I was nearsighted, and then when I was ready to go back to cooking, I'd have to take the glasses off. Oh, how fun it is now. I don't have to take anything off or put it back on. I can see close up, and I can immediately look up, and I can see the television in the distance. I have thoroughly been enjoying that the last few days. It's been wonderful.
How does a patient know that crystal lens is right for them? The first thing you do is ask your doctor.
Eye surgeons these days, like me, offer the full spectrum of vision correction surgery. So we still do LASIK, laser eye surgery for certain patients. For others, we implant a little contact lens. And for others, we do a cataract surgery. So the nice part is now the cataract surgery, when we do it, can offer all the identical benefits of the LASIK laser eye surgery at the same time. We tailor the specific surgery to the patient. How old is the patient? Do they have what eye conditions do they have? Do they have cataract? What are their needs for their vision? And we aim to give them the specific type of surgery that will meet all their expectations.
Eye surgery can make a patient understandably a little anxious. Dr. Devgan discussed the ease of the surgery.
Beautiful. When you think about someone doing eye surgery on you, it sounds a little intimidating. There's a little bit of fear involved there. But it's easy. It's very easy. This is a procedure that has no needles, no stitches. There's 0 drops of blood. And it's absolutely pain-free. And it's a quick procedure. It's usually less than 10 minutes. So it's no more difficult from the patient's perspective than LASIK. One nice part about our surgery is, for cataract surgery, the patient's only involvement is they just need to relax.
For Donna Gallagher, life since her crystal lens surgery has been, well, an eye-opener. No more glasses around her neck. She's spending more productive time in the kitchen, enjoying getting outdoors and walking her beloved dog. But you know what she is really excited about? It's the colors.
I don't think I knew what I was missing was the problem. And I'm someone who loves color. When you look around my house, I do color everywhere. And I didn't realize that I wasn't seeing the brilliance of the colors that were in not only my home but in the world. And the next morning when I got up and my bathroom is this blue and this white, I literally had to get the surgical glasses and put them on my eyes because I wasn't used to this brilliance that hit me. It was so gorgeous. Now I'm used to it now, and it's wonderful.
Donna has dramatically improved vision that she hasn't enjoyed since she was a teenager. But there was one thing she wasn't ready for.
The next morning when I got up after having my right eye done, which is my close-up lens, my nearsighted lens, totally destroyed me. Because what did I see? I saw every single wrinkle on my face. The next day I had to go to my hairdresser. I saw every single pore on his face. I didn't know if I wanted to go around seeing people's pores on their faces. But now I'm in a position of like, okay, maybe we have to consider plastic surgery. It's not beyond the realm of possibility now. So that's a warning. My makeup. I am so embarrassed to think that that's what people were seeing when I was going out. Because my makeup, I realized, oh my gosh, look what you were doing to yourself all these years. So at least now, hopefully I'm a little better than I was, but I want to warn you, it's a shocker that first morning.
That went great. Good. One last drop.
Okay.
Dr. Devgan likes the fact that there are vision correction options for his baby boomer and senior citizen patients. In the 10 years since the first crystal lens was implanted in the United States, It has led the way in vision correction.
One of the nice things in doing cataract surgery is that we can not only fix the cataract, but at the very same time, I can address any nearsightedness, farsightedness, astigmatism, whatever else ails your eye. So even people who've worn inch-thick glasses their entire lives, after I do their cataract surgery, I can give them sharp vision for almost all activities without glasses.
That was very reassuring, wouldn't you agree? So please stay tuned. We'll be back after these messages and continue this discussion on cataracts.
It's fun to be a good neighbor, so say hi to your new neighbors at the LA Zoo. And bring Grandpa. They've got a walking buddy for him, too. They've expanded, so there's even more to see and do. Don't wonder who's here, because just for kicks, they've got birds on sticks. Whatever you do, make sure Mom and Dad come early, because they're certainly ready to say hi to you. And this invitation comes from your good neighbors here at the LA Zoo.
Hey, buddy, pull over! Pull to the right! Don't you know, red lights and sirens mean pull to the right! In an emergency, seconds count. So when you drive, pay attention, or else.
Save it, buddy. The ball call.
Hello and welcome back to The Empowered Patient. I'm here at the Hollywood Wellness Center and I have a very special guest, Phoebe Sievers. How are you? Nice to see you again.
Thank you.
So I see that you're staying active and exercising here, huh?
Yes, I am. Quite a while ago, I realized there was a long history of heart disease in my family, and I just decided that I had to take some action. So I started walking, I started doing exercise, and then I discovered Tai Chi. And first of all, it's a wonderful practice. It helps bone density because you stand for an hour. It also helps high blood pressure, which I have.
Wow.
And I don't know, there are so many things. It lubricates your joints.
So this is wonderful. So you've been practicing Tai Chi, and with this, have you been seeing results? You said it helps with blood pressure. Have you noticed a change in your own blood pressure?
Absolutely. My blood pressure has gone down about 5 points.
Oh, that's fantastic.
And also, I had been on the borderline of osteoporosis, and it's much better. My bone density test is better.
So your bone density's improved, your blood pressure's improved, and this is all through staying physically active, physically fit. And for you, the core, tying it all together, is your Tai Chi.
I think so.
So this is great. So you're thinking preventative, you're thinking what can you do to stay ahead of things, and you're keeping those joints fluid and practicing your Tai Chi. And there was great, I
yes.
understand that you were using this booklet here, Exercise and Physical Activity. This is a product of the National Institute on Aging, and free and available. So for all of you watching at home, it's free and available. So I understand you were using this booklet here.
Yes.
And so tell me, what was it that you found helpful in this booklet?
Well, I really found it very helpful in the sense that it teaches you, like I would like to do weights, and they have a wonderful section about it. And they have pictures, they teach you exactly what you're supposed to be doing. And really, I found the whole book just absolutely full of wonderful information.
So that's great. And it even mentions the Tai Chi in there,
It
I
does.
believe, yeah?
It does.
Yeah.
One more thing about Tai Chi, it
Sure.
does help your balance tremendously.
Absolutely. So I think really a great take-home message for people watching at home. Lots of benefits that you've found from Tai Chi. Definitely a huge benefit in helping with balance. Could really benefit a lot of people. Falls are a serious concern. We want to prevent those. But more than anything, that you found something that works for you And now you're building a program around that. And you're always looking to add different things, but you have a core of something that works for you.
Right.
I think that's very helpful. I think people watching at home might think of ways they can incorporate exercise and physical activity more prominently into their own lives.
Exactly.
Yeah, well, thank you for joining us. It was wonderful having you here.
Thank you.
And it's great to see you staying active. Exactly the kinds of things we're talking about on The Empowered Patient. Staying active, staying fit so that we can live longer, live better, take charge of our health. Please call us. We'd love to hear from you, and we'd love to get these booklets out to you. You can call the number below. These are free and available to all of us. And thank you for joining us on The Empowered Patient. See you next time.
We're back with Dr. Uday Devgan, one of our area's finest ophthalmologists. And it's so amazing for me because I have been afraid of eye surgery for many years. You can tell I still wear glasses. I haven't done all of those corrective things, but the technology has really improved, hasn't it?
It's changed dramatically. In fact, now it's hard to do modern-day cataract surgery without about $1 million worth of equipment.
I see this equipment scattered around your office. It's almost intimidating, but that's not the patient's experience.
No, the patient's experience is actually the opposite. It's actually very simple and very easy. All our exams to measure the eye are done without even touching the eye. We literally just shine lights on your eye.
Wow.
During the surgery, the patient experience is very easy as well. The patient's relaxed, the eye's completely numb, the patients feel nothing.
And this is in the office, right?
Actually, we like to do the surgeries in a real surgery center. So
you do?
We do, because a lot of our senior patients do have other medical issues. I always do it with an anesthesiologist.
Right.
In case the patient wants a little more sedation or a little less sedation, that can be fine-tuned. Then during the surgery, the only thing patients see is they say it's an interesting kaleidoscope of colors.
Wow.
And that's it. And literally about 5 minutes later, the surgery's done.
And there's no bandages? Or?
There's no bandage. There's no eye patch even. If you have an eye patch or cover over the eye, that's not the modern day surgery that I do.
Wow.
So right after surgery, the eye looks normal. There's no patch or cover over the eye. And I expect you to be able to see the clock across the room within 10 minutes, even if you previously had inch-thick glasses.
Unbelievable.
Yeah.
What people's reaction to this, the return of their sight, has to be the most gratifying thing of your day.
Best part of my day is the day after surgery, where I see all the patients who've had the surgery from the day before, and they're thrilled.
Oh, of course.
I'm smiling from ear to ear because the patient is smiling from ear to ear.
Yes.
We do one eye at a time, so we do one eye, and then a week or two later, we do the second eye.
I see.
And we can fine-tune this to exactly that patient's needs. So whatever their needs for the visions are, whether you need to have great razor-sharp distance vision because you're a pilot, or let's say you're an avid reader and you want to be able to read without glasses, we fine-tune it to that specific patient.
You know, for so many seniors, it's really a question of I want to see my grandchildren's photos again.
For sure.
Yeah.
And I think that these days with the modern day surgery and the newer premium lenses, you can see it all.
Fantastic.
So
how do you measure the correction that would be needed for this lens that replaces this cataract lens?
Very important question. We take very detailed measurements here in the clinic before the surgery. I specifically order a custom lens for each patient. It's not just off the shelf, the same lens for everyone. So the lens I'll order for you will correct your farsightedness, your little bit of astigmatism, your need for your reading perfectly. And so we do that for each eye. So it's custom done in advance of the surgery.
I see. Is it possible for a person to put this off too long, that they really can put their vision at risk totally?
Well, the most important thing for a patient to remember is there's no rush to do surgery, but certainly don't put it off forever. The best indication as whether or not you should have surgery is your vision's not good enough for your activities. If you say, I wish I could drive at night, but I can't. I wish I could read the newspaper better, but I can't. You should consider the surgery. If you're happy the way your current vision is, there's no rush to do it.
Right.
If you do put it off for a prolonged period of time, it can make the surgery more challenging and the recovery a little bit more difficult.
I see. But and what is a normal recovery? You said vision returns in about 10 minutes, but post-operatively, what would a patient expect?
Well, like any surgery, it takes time to heal.
Right.
And the normal healing period is just a couple of weeks.
Wow.
Patients start to see right after the surgery, and the vision steadily improves over the next few weeks. And so patients are usually comfortable enough after 1 week to have surgery in the second eye. So even for my parents, I did the surgeries about 1 week apart.
I see. Yeah, okay, I can understand that. Just like, okay, let's see how you did, doctor. One eye at a time.
Of course, and patients want that.
Yes.
And so even in the community, I've done surgery for a lot of my colleagues or their families, the other eye surgeons' families. They do the same, one eye now and one eye in about a week.
Well, on your screen right now, you will see how to contact Dr. Degan, and this is important. As you know, there's a lot of information on the internet. Do you recommend patients inform themselves before they actually come visit?
Yes, this is going to be one of the most important surgeries of your life. Spend the time and do some internet homework.
Right.
Do some reading. This book's a nice start. It's on Amazon. You can certainly get it.
Right. Cataract surgery. It's a patient's guide, so you can just Google this, put it right in. You're also all over YouTube, I understand.
Yeah, I have a lot of, well, my videos on YouTube are actually teaching videos, so I do a lot of teaching for other surgeons to explain how to do the more difficult cataract cases.
Now,
but definitely, spend the time, do the research.
Okay, do people need to watch their diet before the surgery,
No,
or
just-
they should be watching that anyway?
Everything is basically the same as normal. The surgery is no more difficult than a routine doctor's office visit.
I'll be darned. It's so amazing to me. My mother was born with one eye. So in my family, and for virtually all my life, vision and caring for the eye was always the highest priority. And now I see this has become routine.
It is routine, but remember, it's maybe routine for some people, but for you as a patient, this is critical. This will change how you see. Make sure when you see your doctor, spend a half an hour or even an hour with the surgeon before surgery. Yes, the surgery can be only 5 minutes, but it needs to be a surgery that makes you happy as a patient.
Right, exactly. And don't be afraid to look up the qualifications of the person you're going to. I know when we were talking briefly before this interview got underway, I was just amazed because all the places you mentioned where you studied and where you did your internship and now where you teach, I'm going, those are the best in the world. They are the best in the world.
Yeah, well, I'm very fortunate. I've even traveled to 44 countries to teach surgery or do charity surgery missions.
Outstanding.
So it's a fun thing, but most important, be comfortable, take your time, ask a lot of questions, and think before you act.
Well, that's good advice in any circumstance. And for the caregivers, or maybe a son or daughter who is concerned about their parents' vision, how do you broach this subject to mom or dad? Is this when you see them squinting at the newspaper or going, what happened on the television screen?
Exactly. So a good example is I had a patient very recently where the daughter brought him in and she says, I brought him in because he would complain that he couldn't see the scores on the TV. He likes to watch basketball. And he didn't want to have anything done, but then I actually showed him pictures of my mom's surgery before and after and explained it'd be just 5 minutes and that he'd be able to watch the show again.
Wow. And motivation enough for many people. Outstanding. Doctor, thank you so much
My
for
pleasure.
taking time with us today. I feel better already. Thank you, one and all, for watching Aging Well in L.A. And I hope for those of you who may need this surgery, give it a second thought. A lot of highly technical and very personable help is available to you. We'll see you next time.
Bye now.